Short and to the point. This is part of the new updated public awareness campaign against COVID-19. Hand washing is still at the forefront of the fight against the virus. Every country has their own version. We found this one from Vietnam. However the message is put across, though, it is becoming critical. As numbers are reducing in China, they're growing elsewhere. Today has seen the biggest leap in COVID-19 cases in the UK so far, and public health officials are, of course, contact tracing. But they have also said that at least 3 of the 32 new cases in England were passed on here, giving rise to fears that community transmission is now taking hold. The 4 phases for dealing with this outbreak are contain, that's where we are now, delay, research and mitigate. Today, the Prime Minister was asked about the potential for Parliament and MPs to spread the virus, and he appeared to suggest that we are about to move from contain to delay.
The Chief Medical Officer and the Chief Scientific Advisor, together with my honourable friend the Health Secretary, will be saying a little bit more in the next couple of days about what we are going to do to delay the advance of coronavirus. We're still at the containment stage. She will understand the distinction that the government is making. When we come to the delay phase, she will be hearing a lot more detail about what we propose to do with large gatherings and places such as Parliament.
It's not just large gatherings. A small study following the chalet outbreak in France has found that meals at home and in restaurants could be risky.
For example, transmission in a chalet in France, a meal in Hong Kong. And we gathered about 9 of these events and tried to look at the risk and estimated that in these situations, about 35% of the contacts of the case had subsequently become infected. There is a lot of transmission happening. Each case on average is probably infecting 2 or 3 others. So if you think of the average person's number of contacts, that suggests there may be a fairly high risk per contact for that amount of transmission to subsequently occur.
The crux of the public health message is that everyone must play their part. This has led to a run on hand gels. This company, Lincocare, has just received orders for 1 million bottles, and that's likely to increase. In the meantime, a spot check on 4 pharmacies today found the shelves empty. And what about face masks? The Chief Medical Officer has said that wearing them has almost no effect on reducing the risk of contracting the illness. Today in Italy, the police raided a warehouse where masks and disinfectants are being sold online at hugely marked up prices, making money in the face of a disaster. And Italy is in the midst of a crisis. They've had more than 3,000 cases, and today they announced that schools across the country will be closed until March the 15th.
I know this decision will have an impact. As schools minister, I hope pupils can return to school as soon as possible. And my commitment is to ensure that the essential public service, albeit from a distance, is provided to all our students.
It's a measure other countries have also taken, but one the UK government has so far resisted. Experts say there are social consequences, parents not being able to work, for instance, and it is still not clear how the virus is affecting the young.
Victoria MacDonald reporting. Well, earlier today I spoke to Dr. Bruce Aylward from the World Health Organization. He recently returned from China, where he co-led the WHO mission on COVID-19. I started by asking him about Italy's decision to close universities and schools in response to the virus.
Frankly, they may know more than we're seeing in the news, and they may have concerns that are causing them to move that way. Generally, what you want to be doing, though, is looking at what are the drivers of transmission in your community? Where are people getting infected and how? And that should then drive what you're doing. But there are many factors that affect the decisions to close schools.
Do you think that we should be thinking about closing schools in this country, where the rate of infection, well, the number of infections seems to be a lot lower than it is in Italy?
Well, I think what you want to be thinking about is, are you doing the basics? And then you graduate things up, Matt. So the first thing, does the whole population of the UK, do they understand what they're looking for? This is not a cold, it's something different. Do they understand that? Are they hand washing? Are they doing all those preventive measures? Is that rapid case isolation or identification piece in place, and the ability to find the close contacts and quarantine them, et cetera? And then as you move up through those, then you start looking at, okay, do we need to suspend large gatherings because of the way this virus is moving? And no, I would agree with you. It doesn't seem like you're there yet.
Your boss, the head of the WHO, put out a mortality rate number yesterday that had us all gasping, frankly. 3.4% mortality rate for those infected, which is quite a lot higher than the 1% that we were kind of dealing with roughly beforehand. Explain that number to us and why he's now made that public.
Well, when you look at the numbers in China, there's different numbers, right? And I think one of the things that worried the Director General was that people were cherry picking the lowest possible numbers, and they were underestimating what this disease could actually do. And the number that you heard yesterday, that's if you take from the beginning of the outbreak, including Wuhan and the areas worst hit, right through to today and all of China, the number is over 3. And what people often do is they just look at those provinces outside of Hubei and where Wuhan is, and they calculate from once people really knew what they were doing, and they say, okay, at that point, it was down around 1% or under 1%. But, you know, what the Director General was highlighting was, if you don't get on this fast, if you don't know what you're doing, if you're not taking care of your older population properly, this is going to have worse mortality than you're expecting.
Okay, so when you went to China, what did you discover there that should become a lesson to all of us all over the world?
I think the critical things that China did well were, first of all, the population knew what it was looking for. They knew what this disease was. They knew where to go to get tested, and they could be isolated and taken care of very, very quickly. People were part of the solution. They were the surveillance system. You weren't waiting for it to walk into hospitals and infect the hospitals. They had a very well-informed population. Then they had planned the capacity to be able to isolate these cases, and they planned the capacity to be able to find the close contacts, quarantine them, and then take care of them for the 14 days, during which 5 to 10% of them would become cases. And the big takeaways are those. And what worries me always, Matt, is everyone starts with, we can't do what China did. And I said, well, why not? And they said, well, we can't lock down a whole city. And I said, well, China didn't either. I mean, they have thousands and thousands of cities. They locked down a few, where it had really gotten out of control.
But still, it's a much bigger country as well. I mean, they locked down effectively 60 million people, which is virtually the whole population of the UK. Can you seriously imagine this government doing something similar in a country like ours?
I would be seriously surprised and frankly disappointed if the country ever got into a situation where they'd even have to contemplate that. And the great thing you're seeing, Matt, is that, remember, it's not a function of the virus, whether or not you get in a situation like China's. It's a function of how you respond. And what you're seeing as a result of the work of Public Health England, the NHS, et cetera, is they're finding these cases fast. They're jumping on the transmission chains. They're getting them under control. You should never get in that situation. You should never have to even contemplate it.
There's a big debate about closing down schools, which, of course, the Italians, have said they would imminently do. What's the point of closing down schools if kids, according to the evidence, are very unlikely to get this?
We actually don't know what happens with children in this disease. It appears that they're less likely to get infected. It appears that they're less likely to get sick. But a lot of that may be an artifact of the fact that this happened in China at the start of the Spring Festival. Because remember, the Spring Festival in China, all the schools are closed for 2 weeks, and then they extended them. So we don't really know what would have happened if children were exposed to big doses of this thing in school environment. Would they have gotten sicker? We don't know. Probably not, in my mind. But would they have carried the virus back to their families and caused more outbreaks that way? Quite possibly. We simply don't know. So one of the things we're looking at in places like Italy and others that get infected are, have we seen any school clusters that might either result in more sickness in kids or help spread it? So far, the evidence isn't there. And it's one more piece of the puzzle that we haven't got the tools to study properly yet. We soon will, but not quite yet.
Okay, just to bring it back to Britain, we've just had the numbers out. Over 80 cases now in this country. It was 50 yesterday. What can you infer from that?
Your cases are increasing, quite obviously. It's hard to infer from the number. What we need to know, are they geographically clustered and clustered in time and clustered around certain events? Or are these just popping up all over the country and it's evidence of widespread transmission that had been missed, mild cases that have been missed? So the number itself doesn't tell you anything or everything. What it may be telling you is the population is way more aware. They're getting them much more fast, and that could be a very good sign.
You came back from China 10 days ago, I gather. Why aren't you self-isolating?
You isolate the people who are the cases, right? So I'm clearly not a case.
How do we know that? Because you've been tested, or?
Yes, actually, I have been tested. I'm not a case. Well, I'm not ill, let's say. The second thing is I'm not a close contact of anyone, so I'm not quarantined. So isolation is what you do for the case so the virus doesn't spread. Quarantine is what you do for someone who is a contact. So if they get infected, they won't spread in the meantime. But you're not isolating in the sense that they have the virus. I wasn't even, let's say, a low-risk contact. Never came in contact with any cases, never came in contact with any known contacts. Remember, I went into Wuhan, 15 million people were in apartment buildings. I was in big empty boulevards by myself and our team. We came in less contact with people in Wuhan than anywhere I've been since.
Dr. Bruce Elwood, thank you very much for your time.
My pleasure. Thank you.
And later in the programme, we'll have a special report from inside Wuhan on the front line with medical staff. We see the scale of human endurance in the fight to quell the virus. Kathy.
Well, with coronavirus expected to spread more quickly in the weeks to come, there are serious concerns about the possibility that low-paid workers will feel obliged to come to work while infected because they can't afford not to be paid. Today, Boris Johnson announced that the government will be changing the rules to allow sick pay to be claimed from the first day workers fall ill, rather than on the fourth day, as at present. Fatma Manji reports.
The reality of becoming unwell on a low wage has long been a hidden problem in Britain, one that the fears around coronavirus is now exposing. Last night, Channel 4 News highlighted how contract workers in the NHS, like cleaners, have often been reluctant to stay at home when sick because of the financial impact.
One time, a patient asked me, why did I come to work sick? I had to explain, unfortunately, we're not paid if we stay at home, and I can't afford that being on minimum wage.
Today, the Prime Minister announced emergency laws meaning all employees self-isolating because of coronavirus will now be entitled to statutory sick pay from the first day they're off.
So I can today announce that the Health Secretary will bring forward, as part of our emergency coronavirus legislation, measures to allow the payment of statutory sick pay from the very first day you were sick instead of 4 days under the current rules.
This is only a temporary measure, but it's employers who'll bear the cost of it. So small businesses may now demand financial support from the government. And there are many workers in Britain who won't be entitled to it at all, the self-employed and some of those on zero-hour contracts. The government's directing those people to claiming universal credit.
So universal credit, you've got the 5-week wait, which is now notorious, and that is no good if you are at home and being told to self-isolate for 2 weeks or more without food, maybe without some of the appliances that you need to be able to store food at home for long times, like freezers. These are really vulnerable people, and we're telling them to wait 5 weeks. You know, we know universal credit isn't working, it needs to be reviewed, so putting people into a system that is broken isn't going to do them any good at all.
The government says it will look at issues around universal credit, and claimants can apply for an advance from day one. But trade unions argue today's emergency legislation doesn't go far enough, as statutory sick pay is too low at £94.25 a week. The proportion of salary that statutory sick pay covers in the UK is amongst the lowest in Europe. For example, Luxembourg covers 100% of employees' salaries, but the UK covers just 20% of the national average wage. That's beaten only by Malta, which covers 19%. With officials estimating a fifth of Britain's workforce could be sick at the peak of a coronavirus epidemic, there are urgent questions around how both employers and employees will cope financially. But in the longer term, we may also need to ask if our country's sick pay system really protects the most vulnerable.
Well, joining me now is Mike Cherry, who's the National Chairman of the Federation of Small Businesses, and the TUC General Secretary, Francis O'Grady. Francis O'Grady first. You've been pushing for workers to be paid from day one of going off sick. Are you happy with this announcement then?
Well, this is an important step forward, but of course the problem is we're still only talking about £94 a week in terms of statutory sick pay. So people still have bills to pay, rent to pay. £94 isn't going to cover it. And of course, we've still got 2 million people, very often working in public-facing jobs in hospitality and retail, who don't earn enough to qualify for statutory sick pay. So we've been calling on the government...
And freelancers, zero-hour contractors.
Particularly 0 hours, gig economy workers, but women... and low-paid workers in general who are missing out.
So you want this to be extended?
We think all workers should be entitled to proper sick pay.
Let me put that to you, Mike Cherry. Do you think that this offer as sort of a first instalment should be extended to freelancers and other workers?
Well, I think first and foremost, you need to recognise that the self-employed don't get sick pay at the moment at all at the moment. So they're obviously working for themselves. They earn their own money and they're not entitled to the benefits that others are.
So should the government pay for them?
Well, that's a question that you've got to ask government. We can't answer that one for them.
But would you urge that?
What we would urge is government to revisit the point about statutory sick pay, that small employers were cut out of that, being able to reclaim that against their wages and salaries and national insurance, and put that back in place. That is a fundamental around affordability, but also we would be urging any business to look at FSB's website. There is all the information there that you need. You need to be looking at business continuity plans. You need to be looking at your insurance. And we are asking government, HMRC in particular, to give time to pay another chance to support small businesses who just don't have the money on all of this.
But just to pin you down on whether this should be extended or not, employers currently pay statutory sick pay. Would you like that pay, this offer today, to be extended to the other workers that Francis O'Grady was talking about?
Government has got to decide whether it can support all employers in the way that we are asking for. If they decide that there is money available, I think at the moment they're being pushed...
You mean government should pay the bill rather than the employers?
No, what government is saying is that you should apply for universal credit. I'm not sure that's the right answer. And I think there's going to be more involvement on this, on access to finance, on HMRC making sure that they give extended time to pay on the statutory payments that small businesses make.
Francis O'Grady, should government be picking up the bill in these emergency measures, or is it right that businesses are, as I think is the implication of today's announcement?
I think one of our big concerns is that many of the so-called self-employed are put onto self-employed contracts by employers precisely to avoid paying sick pay. So that's one big area of concern. But
let me just get him to respond to that. Is that true?
Well, FSB supports the genuine self-employed who just don't have the option of being able to get statutory sick pay full stop. They need more support.
But when you've got these huge problems in the labour market laid bare, that we have this two-tier labour market system where particularly low-paid and insecure workers have so few rights, it shouldn't take a pandemic for us all to realise and the government to act and reform our sick pay rules so that everybody's protected.
So you'd want the day one sick pay to be made permanent?
Absolutely, and it should be there for all workers.
Do you agree with that?
Clearly, there's a cost implication and there's affordability around that. At the moment, it's the right thing to be doing, given the circumstances we're in.
But when you say there's a cost implication, you believe the government should be digging into its pockets, the general taxpayer, rather than looking for business to pick up?
Well, it comes back to affordability at the end of the day. It is the right thing to do at the moment. Small businesses, as I say, have been excluded from being able to recover the statutory sick pay against their national insurance contributions. That has to be reversed.
I think the problem is the balance of power has gone completely wrong and all the risk now feels like it's on the shoulders of those lowest paid workers, not just for sick pay, by the way, but for pensions too.
Well, is this an opportunity to not just address that imbalance, as you put it, but is it also a chance to overhaul the way we work, more home working? What do you both think on that?
We're very pro-positive flexibility for workers, so when it's properly agreed and where workers want it, it's fantastic to be able to have that kind of flexibility. So it needs to be a two-way street.
There are always going to be requirements for more people to be working from home. We're seeing more self-employed setting up from home. Clearly, in the current circumstances, more are going to be asked to work from home, and it's only right that they be paid appropriately in that situation.
But what we can't have is contract cleaners on the end of a telephone waiting to be called in for a shift, and then if it's cancelled, not compensated. That's the kind of flexibility that I think is giving Britain a bad name and that we need to address.
When you look at what's happened in Italy with schools being closed for 2 weeks and, you know, the sort of theory that this could happen here, is there a danger, in your view, that some of these measures are in danger of causing some pretty catastrophic economic consequences?
Clearly, there's already an economic consequence when schools are shut, when parents have to take time away from work to look after the kids back at home. This is only going to exacerbate that. So employers being able to support more of their employees to work from home is an absolute must, I think, as we take this one forward. For the self-employed, the biggest worry is that they're not going to get the work coming in any case, and they need additional support.
School closures, where do you stand on that?
I think we're going to have to take this step by step. But again, what I do know is that if schools do close, there are large numbers of workers who only get the statutory minimum of unpaid emergency leave. So again, we're going to have the conversation and proper consultation, I think, with both business and unions about how we handle this in a way that doesn't end up with ordinary families paying the price.